Hello, my name is Sabrina. I will be presenting a patient case with my partner Sabrina. We're both second year pharmacy students that attend MCPHS University. Our patient's chief complaint is, I can't get a good night's rest because of these hot flushes I keep having, and my doctor keeps telling me it's due to my menopause. The history of present illness is TS is a 51-year-old Caucasian woman who complains of not being able to sleep for the past few months due to having hot flushes. Her past medical history is positive for hypertension, ADHD, obesity, seasonal allergies, acne through the age of 30, and insomnia. Her past surgical history is having 2 children. In her family, her father is deceased. He was recently deceased in March of 2014, and he died due to prostate cancer at the age of 82 years old. Her mother is still alive. She's 81 years old, and she has obesity and also hypertension. Also, on her father's side, they have a history of stroke. TS's social history includes she's married, she's self-employed, she owns her own business, she's negative tobacco use, negative for illicit drug use, and she drinks around 2 drinks per month just socially, and in college she used to drink 10 drinks per week for 4 years, but she quit drinking that frequently in 1984. Now she works out around 6 hours per week. Her diet is low in carbohydrates. She usually has 2 coffees per day and about 1 bottle of water per day. TS's allergies include honeydew. She generally has a swollen tongue when she eats honeydew. And also MSG preservative, where she gets a GI upset and also diarrhea. TS's current medication list includes lisinopril hydrochlorothiazide, 10 milligrams per 12.5 milligrams, and she takes this 1 tablet by mouth once daily. She's also taking Concerta, 54 milligrams. She takes this 1 tablet by mouth every morning. She's also taking aspirin, 81 milligrams, 1 tablet by mouth daily. She also takes lorazepam, 0.5 milligrams by mouth as needed for sleep, along with melatonin, 5 milligrams by mouth as needed for sleep.
Alright, I'm going to go over TS's review of systems. She is positive for night sweats and fatigue, and negative for weight loss or weight gain. For her head, ears, eyes, nose, and throat, she is negative for vision problems, double vision, glaucoma, cataracts, hearing problems also, and negative for ringing in the ears, earaches, sensation of room spinning, negative for nasal congestion, nasal discharge, nosebleeds, sore mouth or throat. She is also negative for bleeding gums, negative problem swallowing, or hoarse voice. For her endocrine, she is negative for swollen glands, diabetes, or thyroid problems. She is also negative for respiratory, cough, sputum, shortness of breath, negative wheezing, and negative cigarette smoking. For her cardiac, she is negative for heart pain, high blood pressure, heart irregularity, negative for palpitations, swelling of the legs, difficulty breathing when lying flat. For her GI, she is positive for constipation, but negative for reflux, heartburn, hepatitis, stomach or intestinal ulcer, and negative for nausea and vomiting. For genitourinary, she is negative for frequency, blood in urine, negative burning with urination, and negative difficulty holding or controlling urine. For her musculoskeletal, she is negative for joint aches, muscle weakness, negative muscle cramps, negative leg weakness. In neurology, she is negative for headaches, seizures, tremors, migraine, numbness, or fainting. When it comes to her heme and lymph, she is negative bleeding, negative blood clots, and negative swollen glands. She is also negative for rash or current infections. For her psych, she is positive for sleep disturbances, negative crying spells, negative depression, negative anxiety. I'm going to go over TS's problems list now. Our first problem is that TS is experiencing menopausal symptoms that are not currently treated. These symptoms are contributing to our patient's insomnia. She is also on 2 potentially unnecessary drug therapies, one being lorazepam and the other being melatonin. We believe that once her menopausal symptoms are treated, that she would no longer need to be on the melatonin or lorazepam for her insomnia, and that we would also like to counsel her on sleep hygiene. Our last problem is that TS has experienced constipation also. First, we would like to recommend increasing her water intake and a diet rich in fiber. And then if symptoms continue to persist, possibly a laxative. But that is of low concern today.
Upon interview, we decided our patient, TS, is experiencing hot flushes that are interfering with her sleep due to menopausal symptoms. We also decided we would like to initiate a therapy to control TS's menopausal symptoms that are interfering with sleep. Our goals of therapy would be to decrease these hot flushes at nighttime to avoid any sleep disturbances, and also to increase the overall quality of TS's sleep. As a team, Sabrina and I concluded that the pharmacological plan that's suitable for TS's symptoms include venlafaxine XR 75 milligrams by mouth daily. We would like to monitor for efficacy based on the decrease in her vasomotor symptoms in around 4 to 8 weeks, considering that's how long it takes for the therapy to start working. Also, adverse drug reactions will be monitored for, and these include headaches, somnolence, insomnia, nervousness, anxiety, nausea, constipation, anorexia, and weakness. Although these side effects tend to be rare, it's important to look out for these side effects in patients. Also, we would like to follow up with the patient in around 6 weeks to evaluate for efficacy and hope that her decrease in hot flushes help aid her in a good night's rest. We would also like to initiate a non-pharmacological plan to help TS with her sleep. We would like to initiate some sleep hygiene recommendations that will help TS get a good night's sleep, and these include only using the bed for sleeping and intimacy, attempting to keep the bedroom tidy, dark, and quiet, avoid the use of electronics, especially those with light-up display screens near bedtime, and also by giving TS more time to relax prior to sleep. Considering TS's symptoms of constipation, we would like to increase her water intake considering she's only drinking about 1 cup to 1 bottled water daily. We would like to aim for 8 cups of water per day, and this can be evaluated by determining if her TS is still experiencing constipation. If so, she will need further follow-up to treat these symptoms.
Now I'm going to explain how we collaborated on this project together. Serena and I are both pharmacy students. We were unable to have the opportunity to work with another discipline for this project. We delegated our tasks evenly. We performed the interview. We made a problem list and analyzed the data together. We agreed on an ultimate treatment based off the guidelines and worked as a team to create a patient care plan based off of specific patient needs.